Welcome, fellow homeopaths and enthusiasts. Have you ever wondered how to navigate the subtle relationships between remedies in our vast materia medica? Today, we are diving into a powerful concept that helps illuminate these connections, the Joslin Circle. This insightful framework, particularly relevant to BOENNINGHAUSEN's therapeutic pocketbook, offers a visual and practical way to understand remedy similarity and enhance your prescription skills. Let's explore how this concentric model can deepen your understanding and lead to more effective treatment. Now let's see the first biography. The Joslin Circle in homeopathy is named after Dr. Benjamin Franklin Joslin from 1796 to 1861, an early and influential American homeopath. He was a strong proponent of homeopathy and contemporary of Samuel Hahnemann, our master, the founder of homeopathy. Dr. Joslin made significant contributions to understanding and application of homeopathic principles. While Dr. Joslin did explicitly draw the concentric circle diagram himself, the concept of grouping remedies based on their degree of similarity, particularly in relation to BOENNINGHAUSEN's work, is attributed to his interpretations and teaching. His understanding of the relationships between remedies, especially as presented in BOENNINGHAUSEN's therapeutic pocketbook, laid the groundwork for this visual interpretation. Therefore, the Joslin Circle is named in recognition of Dr. Benjamin Franklin Joslin's insightful work in the interpreting and clarifying the relationships between homeopathic remedies, which ultimately led to the development of this helpful visual aid for homeopathic prescribing. The planet closest to the sun are remedies that are very similar to it in how they act and what problems they help with. These are in the inner circle of the Joslin Circle. If your sun remedy helps a bit but not completely, you might look at these nearby planet remedies next. They share a lot of the same energy. The planets further away are still related to the sun. They are in the same solar system of homeopathy, but they are less alike. They might help with some of the same problems, but in a slightly different way or for different types of people. These are in the outer circles. So, the Joslin Circle in homeopathy just shows you which remedies are most like the one you pick based on how they show up in the big book of symptoms, the repertory. The closer they are in the circle, the more similar they are in their action. It is like a family of remedies with the closest family members in the inner circle. Now we will understand Joslin Circle in depth. The remedies having harmony with each other. The most similar ones, as a rule, are complementary. They antidote each other's bad effects. Others with a lesser degree of similarity may be used at a greater interval of time. They have a much lower ratio of similarity. We may use here the illustration of the concentric circles of similarity as suggested by Joslin. The nearer the center, the smaller the circle, and the higher the ratio of similarity. As the circle widens, the complementary qualities of the remedies occupying the outer circle lessens until their similarity to the similimum is very slight. Every mineral or chemical element has grouped closely about it a little circle of closely related vegetable remedies which are complements to each other. Now you can see the visual representation of BOENNINGHAUSEN'S circle. The graph shows how homeopathic remedies related to a central remedy. The central remedy is in the middle and other remedies are arranged in circles around it. Remedies closer to the center are more similar to the central remedy. This chart visually explains the concept of BOENNINGHAUSEN's concordance, often associated with Joslin's circle analogy in homeopathy. This chart illustrates how different remedies A, B, C, D and E relates to a central remedy based on BOENNINGHAUSEN's concordance. Now let's see. Remedy A and B. These are in the innermost circle and have thick arrows connecting them to the central remedy. This signifies a very strong and close relationship, meaning they share a high degree of similar symptoms and characteristics, making them highly concordant alternatives. Remedies C and D, located in the middle circle with slightly thinner arrows. This remedy shows a moderate relationship to the central remedy. They share a good number of similarities but are not as strongly concordant as A and B. Remedy E, in the outermost circle with the thinnest arrow. Remedies E has the weakest or most distant relationship to the central remedy in terms of overall symptom similarity within the concordance system. Now we will see the concluding part. In conclusion, the Joslin circle provides a valuable framework for understanding the degree of similarity between homeopathic remedies, especially as organized within BOENNINGHAUSEN's repertory. By visualizing remedies in concentric circles, we gain a clear understanding of potential follow-up or potential follow-up remedies and the intricate relationships within our materia medica. We hope this video has illuminated this important concept and empowers you to utilize the Joslin circle in your homeopathic practice for more effective and nuanced prescribing. Thank you.